Ashley, and I'm here with Jonna, who's just been diagnosed with CHF. Hi, Jonna. How are you feeling today?
I'm feeling all right. Just feel like I have a really bad cough and my chest hurts.
Oh boy, it sounds like you're having, some really bad side effects. Let me tell you a little bit about CHF. Can you tell me, first of all, what you already know?
All I know is that it affects my heart.
Okay. Well, you're right. It is a syndrome in which the heart is unable to pump enough blood to meet the oxygen requirements of the tissues and the organs in the body. When the heart is weakened, it is unable to keep up with the demands placed upon it. The blood returns to the heart faster than it can be pumped out, so that it gets backed up or congested. Here's a picture kind of explaining a little bit about what CHF is. Right here, this is a normal heart, and the left ventricle and the right ventricle are of normal size, where it's able to pump enough blood out to get to the rest of the body. In a heart with CHF, the left ventricle is slightly larger, which makes the filling of the left ventricle with the blood a lot more, and it's unable to pump out a lot of the blood. So therefore, there's blood retaining. And it attempts to compensate by this pooling of the blood by retaining the salt in water, which increases the amount of blood in the bloodstream. It begins to beat faster and gets larger. Over time, when it cannot keep up with the blood supply, the fluid starts to build up in the body, and you begin to feel symptoms of CHF. These include weakness, shortness of breath, rapid and irregular pulse, swelling in the legs, ankles, and feet, and sometimes a dry, hacking cough.
How did I get this?
There are many risks that can contribute to the development of CHF. Some of them are smoking, obesity, diabetes, hypertension, consuming foods high in fat and cholesterol, coronary artery disease, a heart attack, and sometimes some severe infections. It is important to know that CHF is typically a symptom of an underlying cardiovascular disease or problem. Therefore, it is often necessary to keep all of your follow-up visits and notify your cardiologist of any new or worsening symptoms. One, most importantly, being monitoring your weight gain. You want to notify your doctor of a weight gain of 2 pounds or more in 1 week. This can signify fluid retention and pooling in the peripheral tissues.
What can I do to prevent complications?
The most important thing you can do to prevent any kind of complications is make lifestyle changes. This is including a diet in low sodium, low fat, low cholesterol. Restrict your fluid intake to what the doctor has prescribed. Quit smoking. Increase your daily exercise and activity level. Weigh yourself daily at the same time every day. Take your medications as prescribed. Monitor your blood pressure and heart rate, and become familiar with your normals for your blood pressure and heart rate, so you can be able to identify any significant changes and notify your doctor of those changes.
What kind of treatment can I expect?
The treatment will usually begin with identifying the underlying condition, like cardiovascular disease, an MI, or a heart attack, hypertension, cardiomyopathy, and any heart arrhythmias. You want to make sure you reduce stress and make lifestyle changes. In some cases, hospitalization may be necessary to alter or adjust and initiate medications, and sometimes for surgery. Oh, it is very important to notify your doctor of any signs and symptoms of a worsening condition, and to not hesitate to call your doctor with any questions or concerns. I hope this information has been helpful to you. Thank you, and have safe travels.
Thank you.